Greetings for everyone. Today I'll talk about acute exacerbation of COPD or chronic obstructive pulmonary disease. COPD is one of the four leading obstructive disease, and it is mostly encountered in smoking people for a long history. Also may be seen in recurrent infections or in a patient with cystic fibrosis. So let's start. How to diagnose exacerbation of COPD? One of the good tests is the chest X-ray, and chest X-ray is used for most of lung diseases, like a first-line test. We can see hyperinflation of the lung. When lungs are hyperinflated, diaphragm will go down, you see here. From acid-base analysis, we can see many features like hypoxia because of decreased ventilation, not effective ventilation, and hypercapnia. Because of this hyperinflation, air is like trapped inside O2 and CO2, and it makes difficult to pass in or out of air. CO2 is trapped, and from this rotation we'll have hypercapnia. And as a result, on acid base with equilibrium, we see respiratory acidosis with possible metabolic alkalosis as compensation. It's from retaining of bicarbonate. What are the cardinal symptoms, or I can call them worsening symptoms of the disease? So you see here three components: dyspnea, cough, and sputum. And changes on them, like dyspnea, it's increased dyspnea, more pronounced, especially nocturnal one, or orthopnea. If we are talking about cough, it's more severe, more pronounced, that will lead to cyanosis. And sputum production, change in a quality, in a color, consistency, and if patient didn't have sputum before, now will have. How to manage the disease? So patient have deficit of oxygen and retention of CO2. So give oxygen supply by nasal cannula or a CPAP mask. Target is like 88 to 95 blood saturation, and also we can give any bronchodilators like beta agonists, albuterol is short-acting one, or a cholinergic antagonist like ipratropium. If any of them do not help, we are going to glucocorticoids like betamethasone, fluticasone, or any other inhaled corticosterone. So, if detect infection or have one or some more cardinal symptoms, give antibiotics. For infection, yes, we can couple this infection and give antibiotics. Also, if you have more than one cardinal sign that let's review them, as dyspnea, changes in dyspnea, cough, and sputum. So if you have any changes, and more than two mean at least more than one mean at least two components like sputum and cough. Also, if patient do not respond to the above medication, give non-invasive continuous positive pressure with oxygen, like FiO2. That means from a whole flux of air that come to the patient, like 40% will be oxygen. It's a fraction of oxygen. It is a CPAP mask. That means a continuous positive airway pressure mask. It may be portable and home adapted. So if with this CPAP mask patient do not improve we are going to intubate, usually oral tracheal intubation, and at least half of hour need for changing in respiratory indices. So if intubation fail, try to do a cricothyroidotomy. It's the last option and not often doing. So thanks for watching my lectures. I plan to do some lectures on mechanical ventilation. So enjoy my lectures, and if you'd like them, subscribe. See you soon. Bye.